way prevention is going to look. So I just wanted to just add that to the conversation. Thank you.
Thank you.
Good evening. I'm Valerie Rochester with the Black Women's Health Imperative in Washington, D.C. And as we're talking about strategies, I'd like to make the recommendation that we take another look at how we determine who the priority populations are that we're addressing with HIV. I think we can all understand and recognize the fact that women of color are at increased risk of developing HIV or contracting HIV. We're seeing increasing numbers of women of color. However, women are not a standalone priority population with CDC or any of the other health agencies. African American women are lumped together with African American men, as African Americans generally, and the same with Latinas. So until we take a stand and make women and women of color in particular standalone priority populations, I think we're going to continue to see these numbers that we're seeing. We won't see the research being done into how HIV impacts women. We won't see the numbers going into treatment methodologies that are specific to women, and we'll continue to see these numbers increasing.
Thank you.
I'm Gloria Lockett, the Executive Director of CalPEP, California Prostitutes Education Project. I want to speak a little bit about the Minority Initiative. If it would not be for the Minority Initiative, CalPEP and a lot of other state-funded organizations in California would not have been able to test for HIV. HIV and prevention was cut totally from June 30th until November 1st. So I'm just speaking in support of the Minority Initiative. Without federal funds, we would not be able to do the work that we do and have been doing for the last 25 years.
Thank you.
My name is Reverend Tony Green. I'm the pastor of a church in Albany, New York, and I'm also a chaplain for community hospice. First of all, I'm just pleased with the President's signing of the Shepherd and Bird Act. I hate the word act. A long time coming. In my church, I was very proud of the women's group. They got together to put together some health kits to go to a shelter, and my partner, Perry, suggested that they put condoms in the health packs, and it created conversation with the women, and they decided to do it. So, these are things that can be done out of churches, but more specifically in my role as a hospice chaplain, I think spiritual care is so important to the overall health of our community. And maybe look at the model of care of hospice, where you have the medical professional, a social worker, and then the spiritual care provider, where it's not religious specific, but we tend to be generalists and have some special skills around hospice care. We could do the same thing with HIV and AIDS. So when the woman spoke about standards of care, I think that's very important, and to create something that is a model that ripples throughout the United States. Thank you.
Thank you.